My experience at Maplestone was a very positive and influential one with many challenges and benefits, and I found that I took a lot from it. First, I'll begin with the challenges. The challenges that we had within our group were more logistical challenges. Time was a concern. Having so many different professions in the same room, it's hard to get them all together at the same time. A lot of them had different focuses at the time because they were either already professionals or there were students studying, trying to do that. So even though we had a specific time to meet, a lot of times people would find a lot of difficulty, and probably in real world situations, I can imagine that's even harder. Also, organization of ideas are always very demanding with an interprofessional group, specifically with our group. When we were doing our presentation, having 10 or 12 healthcare professionals everyone trying to get their ideas in can lead to a lot of confusion and a lot of debate, which is time consuming. And actually doing the presentation itself seemed to be a bit of a challenge because every health profession wanted to be represented. And in that way, it was very difficult to get each one their allotted time to speak in such a short presentation. So that, again, can be very difficult. The other challenge that we had was, even though you have 8 or 10, 12 healthcare professionals, you don't always have everyone that you need. We were very fortunate to have quite an array of professions represented. However, every so often we run into a problem when we went into an area that wasn't covered by anyone. So that's a little difficult. Or an area that's actually overlapped with 2 professions is also can be difficult. However, there are many, many benefits. First of all, having it at a location such as Maplestone was a huge benefit, especially for people trying to learn how to communicate interprofessionally, since the patients that you're dealing with at a long-term care facility are so constant, as opposed to having them at a hospital where the patient turnover is so much quicker. With a place like Maplestone, if you have a patient there, they're going to be there the whole time that you're doing your series of meetings. I think ours was over a period of 4 weeks. So that was a very large benefit. And through this program, one important thing that I learned was just about what other health professionals do that I had no idea of beforehand. One such example would have been occupational therapy. I really didn't know what they did or what their role was before that. Now I do, which is a great benefit. Also learning about the patient, which is really important. Learning that their needs aren't just met by what you've learned in school, which I found was a big issue for just about every one of the healthcare professions. When you go into this program, you're almost thinking, and you're almost taught to think, that my program is the main concern. When I'm going to come in here and I'm going to blow these people away with, the ideas that I've been taught. But then as you communicate with others, you learn about the patient, you realize, wait a minute, mine's only a small part and it's somehow connected to all these other parts, which is a huge benefit. And also very important is learning how to communicate with all of those many people. Talking to other healthcare professionals sometimes can be very challenging, but when you're exposed to them constantly, then you learn how to talk to them, how to share your ideas, how to accept their ideas, and that's also very important. What I took from this whole program was knowing when to call for help. So knowing when a patient comes to me, if this is really a problem that I can immediately solve, or should I be recommending they go somewhere else? Can I identify the fact that they do have an issue that's outside my realm, and I know who to contact? Knowing how to call for help, knowing how to talk to the other healthcare professionals, and knowing how to get a hold of them, also very important. And most importantly, knowing that I'm not the only piece of the puzzle in a patient's problems. They may come up to me with questions concerning medications. However, that question may only be one small piece of a large problem that they're facing. It may just be only the surface. And being able to identify that was also very important. And that's it. Was it good?